Like when a girl or when a woman complains about the period pain, the elders in the family say it is all in your head.
So they should definitely seek help of the healthcare provider. They should speak up and they should educate themselves. Is it normal or not? Is it different from the normal menstrual pain, or it is something if the pain is more severe and the child is not able to bear the pain, they should definitely go and seek a instances. 1 in 10 women are experiencing, and in infertile women there is instance of 30 to 40%. Blood is flowing in a reverse direction, that is retrograde menstruation. Because of that, this is one of the proposed theory to endometriosis. So it is not a modern disease, it is definitely having a historical background.
Will regular intake of these birth control pills affect the fertility in the later years? What are the effects of this endometriosis on fertility of the woman, ma'am? How does the current lifestyle of women affect the fertility of their future children? Ma'am, straight question. Will people die because of endometriosis? Welcome to Medicas Video Podcast. My name is Varun. Thank you so much for all the appreciation and encouragement you have been showing to us for all the content that we are putting across, especially with related to health. You can find all this information on Medicas social media channels, Instagram, Facebook, as well as YouTube, and also on our LinkedIn. So there is a lot of authentic and credible healthcare related information we are putting across to general public for the whole world to consume, get their facts right, as well as ensure that they correlate this and also check with their healthcare practitioners before they take any measures using this information that we are putting across. And also curated with the help of the healthcare professionals so that this adds credibility and authenticity when it goes into the public. Today, we are going to talk about a very important subject related to women health. A lot of women around us have been experiencing a lot of physical and mental health related issues. This topic that we are going to talk about is related to physical health, which is nothing but endometriosis. A lot of women around us may be experiencing this particular disorder. However, they may not be opening up or they may not be realizing that they have this particular disorder. There are certain other disorders that are related to endometriosis, which we may not be knowing about it. So let us discuss about this topic today. I'm sure a lot of you may be knowing about it, but for those who do not know, and for those who already are aware of this topic, don't miss this subject and do not miss this podcast because we discuss very important details in this particular podcast, which you may not be able to find anywhere else. And to discuss this subject, we have Dr. Mounika Y. She's an obstetrician and gynecologist and also an infertility specialist with several years of experience. So let's welcome her on board. Dr. Mounika, thank you so much, ma'am, for joining us today. How are you doing?
Yeah, I'm fine.
Thank you so much, ma'am, for accepting our invite. It's been a pleasure once again to actually have you on this podcast and discuss some very important topics as well as some tips and health concerns and myths related to women health. Ma'am, as you know that we are connecting today to discuss about certain health related concerns around endometriosis, ma'am. A lot of women may have heard about endometriosis and there is a lot of content that is available in public. If you have to talk about endometriosis, can you explain to the public what is endometriosis?
So, endometriosis is the growth of endometrial glands and stroma that usually stay in the uterine cavity. They grow outside the uterus, like in pelvis, even bowel, diaphragm, and even in lung also. Because the endometrial tissue grows outside the uterine cavity. That is the basic concept of endometriosis.
Oh, okay. So ideally, where should this endometrium lining should like? Excuse me if
So,
that's the wrong term that
endometrial
I used. Uh-huh.
Yeah, endometrial lining is usually only within the uterine cavity. That is the base of implantation, also we can say, or if the patient is not pregnant, they'll menstruate. That endometrial lining will come out of the women every month. That is nothing but menstruation. but that
Okay.
growth outside the uterus, that is nothing but endometriosis.
Okay. Ma'am, how often do you see such kind of cases? Is this
Yeah,
something new or has this been there with us for several years?
yeah, it's been there with us from several years. Incidences 1 in 10 women are experiencing endometriosis nowadays, and in infertile women, there is incidence of 30 to 40%. And coming to its prevalence, there is real prevalence and apparent prevalence. Real prevalence is due to delay in marriages and delay in first conception and small family norms. And coming to the apparent prevalence, advent of the newer modalities like laparoscopy. We will do laparoscopy for some other cause, we will find endometriosis in it. So by these modalities, its in prevalence is also increasing, and it's not it's always has a historical background, like in 1970s only they discovered that the women are experiencing severe pain during menstruation. Like Samson, Dr. Samson, he discovered that women are experiencing severe pain during menstruation, and proposed a theory that the menstrual blood is flowing in a reverse direction, that is retrograde menstruation. Because of that, the endometrium is growing outside the uterus. This is one of the
Oh.
proposed theories of endometriosis. So it is not a modern disease, it is definitely having a historical background.
Okay, okay. Ma'am, I also read it somewhere when I was actually researching about this. This endometriosis as a disease, why is that the symptoms or the diagnosis is delayed?
Yeah, there is a delay in diagnosis because there is no definitive non-invasive test for diagnosing it, and
Okay.
the normalization of the menstrual cramps. If we are experiencing some menstrual cramps, they'll say that it is okay, it is normal only. You need not go and meet a doctor. Because of that, there is delay in diagnosis, and also of the non-specific symptoms in endometriosis. We see apart from menstrual cramps, there will be some bowel disturbances and some other symptoms. Because of that also there is delay in diagnosis.
Okay, okay. Ma'am, that is another question I have actually written it to ask you. I was told that because of endometriosis, there may be some issues related to gut health and irritable bowel syndrome. Is that true? And how does it affect, ma'am?
Yeah, it is definitely true. As I already told, the endometrial lining is growing outside the uterus. In these cases, the endometrium will grow nearer to the bowel. So, because of that, endometrium, wherever it is, it will try to come out. Because of that, the patient will experience pain. So, when it is nearer to bowel, they will develop symptoms like bloating, diarrhea, constipation, and pain, which is similar to IBS. They will have the similar pain, so the patient will be confused whether it is related to gynec or gut. They'll be in confusion.
Exactly, ma'am. Correct. Ma'am, you just mentioned that one of the symptoms for endometriosis is period pain. So I have two questions related to that, ma'am, which is related to symptoms of endometriosis. First, my first question is, what are the symptoms of endometriosis, ma'am?
So symptoms of endometriosis are generally chronic pelvic pain. The pain doesn't subside easily, and they will have infertility issues and pain during the intercourse, that is called dyspareunia. Dysmenorrhea is painful periods. And apart from these, as I already told, the non-specific symptoms like gut-related symptoms also they will experience. And heavy menstrual bleeding, intermenstrual bleeding, cyclical pain. These are all symptoms of endometriosis.
Okay. Ma'am, in the recent times, a lot of women may be experiencing most of the symptoms that you just mentioned. Irregular periods, heavy menstrual cycle, and etc. When does a woman have to be aware or should be worried with the period pain? When is the period pain more where she needs to consult a doctor or worry about endometriosis?
When period pain is more than the usual and not subsiding by medication, and when it is cyclical, and also other than menstruation also they'll have pain, like I already
Okay.
told you, chronic pelvic pain. The pain will be constant. Even you are taking any medication, over the counter drugs are also available nowadays for period pain. Even if you take those medication also, it is not subsiding, then it is a sign that you should meet your gynae doctor. And also intermenstrual bleeding, these are all intermenstrual bleeding may be in some other conditions also, but mainly specifically this bleeding thing, heavy menstrual bleeding that is cyclical, and also constant pain in the pelvis. These are the
Okay.
signs where you should meet the doctor.
Okay, okay. Thank you, ma'am. So, ma'am, in the cases that you probably have received in your clinic, so can you give us some real life examples as to what kind of endometriosis cases you have handled, and what were the stages, probably what was the medication given to them? Any case that, that surprised you?
Yeah, recently we had a case. The patient was just 24 years old. She has a 1 year child and she's very young, 24 years. She presented with complaint of pain abdomen and heavy menstrual bleeding. Upon investigating, we saw in ultrasound that is there is a huge complex ovarian cyst. It seems to be
Oh,
like endometriotic cyst. So
okay,
we have sent for her further investigation like MRI. So in
okay,
MRI, they gave multiple endometriotic cyst. Largest measuring was 7 centimeters. So we should definitely remove that endometriotic cyst. So what we thought was just it's a simple case. For us, it's a simple case because it's just an endometriotic cyst. We'll just remove that. That is our plan in the mind. But when we posted for her laparoscopy, we were shocked to see that there is multiple endometriotic cysts. You don't believe that the ovary, the tube, and the fimbriae all were included in that cyst. We couldn't see the ovary also. And
oh,
the bubble was adherent to it. The appendix was
okay,
also adherent. So it became
okay,
very difficult for us to separate whenever we are planning to remove the endometriotic cyst. If the bowel is adherent, it will become complicated. We have to separate
okay,
the bowel from the cyst and remove the endometriotic cyst. Usually, we will try to preserve the ovary, but in
okay.
this case, we couldn't preserve the ovary. We removed the tube, we removed the ovary, and also we had to remove the appendix. It was
Oh, so
very
the
sad
chances
for
of
her.
this lady getting pregnant again is almost nullified.
No, no, not nullified. She has another tube and another
Okay,
ovary
okay,
on the other
okay.
side. But definitely there is a decrease in 50 to 60% in the future
Chances. Okay,
pregnancy. Yeah.
okay, okay. Ma'am, on the same lines, you mentioned about the endometriosis cyst, right? So, what happens if that cyst gets bursted? Will that cyst burst in the body? That's my first question. And how do you know if that cyst is not cancerous cyst?
Yeah, there are some blood tests which we do prior to the surgery itself. They are called tumor markers. There are some tests like CA-125, which indicates the amount, indicates the malignancy, whether it is benign or malignant. We have to do those
Okay,
tests prior to the surgery itself. And as you told, as you asked, the endometriotic cyst is doesn't like there are rare chances of rupture,
okay,
like other than ovarian cyst. It is rare to get ruptured, but
okay.
because of that, it appears as a chocolate cyst. When you open in the laparoscopy, just if you poke it, chocolate color fluid will come out. That is a
Okay,
distinct sign to differentiate from other cysts. And the chances of turning into malignancy are there, but little bit less.
okay, okay. Ma'am, you also mentioned about this case you have handled where it went into a surgery. Will all endometriosis cases go into a surgery, or what are the different stages that we can see in endometriosis, ma'am?
Yeah, there are definitely stages in endometriosis. There are 4 stages like minimal, mild, moderate, and severe. In minimal cases, there will only few lesions in the pelvic organs, like apart from uterus, in the ovaries or surrounding the uterus. And when you're increasing the stage, like in moderate, there will be endometriotic cyst, and just as I told you. And in severe cases, there will be peritoneal implantations and Omentum is the structure covering the intestines. There will be deposits in the bowel, omentum, peritoneum, everywhere. That is the
Okay,
severe stage. So in
okay,
severe stages, we should definitely go for surgery.
okay, okay. Ma'am, straight question. Will people die because of endometriosis?
No, no, though. They won't
No.
die.
Okay. But they'll have to bear this chronic pain, throughout their
Yeah,
life.
yeah.
Okay.
Chronic
Ma'am,
pain
are
is,
right.
yeah.
Ma'am, what are the treatment options for endometriosis in these stages, ma'am?
Yeah. Initially, most of the patients will present with pain. So, pain management is very necessary in these patients. For pain management, we have different kinds of medications like in minimal disease, we have NSAIDs, which decrease the pain. And apart from NSAIDs, we have hormonal therapy, like birth control pills. They stop the menstruation and decrease the growth of the endometrium. And also progesterone controlling containing pills like intrauterine devices or Depo-Provera, they stop the menstruation. And also GnRH agonists, we say, agonists or antagonists, they create a temporary menopause-like state, which is reversible. So all these drugs
Okay.
are there for pain management. And also we
Okay.
have another drug like danazole, which is a synthetic androgen. It also shrinks the endometrium. With
Okay.
all of these medications, we can control or manage the pain in the patients.
Okay, okay. Ma'am, the pain is fine. Now, how about the cure for endometriosis? Is there a cure or is this a lifelong disease?
It is definitely a lifelong condition, but
Oh,
as the age of the patient increases, there will be chances of decrease in the endometriosis because as is an estrogen dependent condition, as the age of the patient increases, estrogen will definitely come down and there may be some relief in the symptoms. But
okay.
on the whole, it is a lifelong condition.
Okay, okay. Ma'am, as we are talking about these symptoms that are observed late, um, just like mammogram, like your doctors recommend patients to go for a periodic mammogram or periodic pap smear test. Do you also recommend or should patients go for regular checkups for endometriosis also?
See, endometriosis doesn't go like that. If the patient comes to you with a 3 or 4 centimeters endometriotic cyst, it must be removed. So we
Hmm.
can't wait. Like in another conditions like simple ovarian cyst or some other ovarian cyst, we'll just follow up the patient after you come after 3 months. If there is an increase in size or increase in symptoms, we will go for surgery. But endometriosis is not like that. So
Okay.
definitely there will be a surgical management depending upon the severity of the symptoms.
Okay, okay. Well, as we are now talking about these reproductive organs, what are the effects of this endometriosis disorder on fertility of that woman, ma'am?
Yeah, definitely they'll land up in infertility because the endometrium, which is present all over the pelvis or other bowels, it will cause inflammatory state. Because of that, the immune system will get disrupted and there will be decrease in the chances of fertility.
Okay, okay. So this definitely has an effect on the fertility. Ma'am,
Yes,
you
yes.
just have given us a case study of a case which scared you or which was shocking to you. Is there any other case where it has given you the utmost happiness related to endometriosis?
Yeah, some of the simple cases also we did in which the MRI ultrasound were correlating with our plan of management. Simple endometriosis is 3 to 4 centimeters, which with the severe pain. Those cases also we did.
Okay.
Most of the time, it will be cured. Like in the surgery itself, we can remove the cyst. But this case was shocking because there was bowel adhesions also.
Yes, ma'am. Yes. Ma'am, in the cases that you have seen personally in your day-to-day OP or outpatient category, what age group of women are coming to you and you have identified they have endometriosis?
Yeah, mostly reproductive age group will people will be coming around 30 to 45, you can say. And this
Okay.
patient was 24 years. That was also shocking for us. Very
Oh,
young
yeah.
patient. Usually reproductive age women we see endometriosis.
Okay. Okay. Ma'am, there is this another thing that usually happens in every family. Like when a girl or when a woman complains about the period pain, the elders in the family say it is all in your head. What do
Okay.
you have to say to those kinds of parents or elders?
So they should definitely seek help of the healthcare provider and they should speak up and they should educate themselves like that is it normal or not. Like, is it different from the normal menstrual pain, or it is something patient is suffering? They should know. So definitely, if the pain is more severe and and the child is not able to bear the pain, they should definitely go and seek a healthcare provider, help from the healthcare provider.
Okay, okay. Ma'am, for the sake of our audience, can you give us an example where the patient has been brought in for a simple period pain? When I say simple period pain, the period pain what the girl is experiencing, but the result after you diagnosed shocked you and also the patient. Is there any case that you can give us as a real life example, ma'am?
Yeah, in reproductive age women we see most commonly, but in teenage it is a little bit less. Endometriosis is a little bit less, but we have seen a case of 16-year-old girl. She presented with severe pain during menses, and her mother also had a similar complaint, like pain
Oh,
during menstruation. So when we have done an ultrasound, we found that there is some endometriosis developing in her uterus. So for her, but because of her age and staging of the endometriosis, just the stage 2, we managed with medical management.
okay, okay. This is interesting actually. So, I
Yeah.
mean, even then, she has to live with that for the lifelong situation, right? She needs to continue to take that medication, right, from 16 years onwards.
Yeah, yeah. It is better to take medication because it will definitely impact her day-to-day activities. Because of the period pain, she can't do her daily activities because there will be emotional stress, anxiety. So if we take medication, doesn't cure, but it temporarily reduces the symptoms at least.
Exactly. Ma'am, you just spoke about anxiety and mental stress. So, for those women who are suffering with this endometriosis, as this is a lifelong disease that they should be managing themselves, what guidance or what words of thoughts you would like to give to the guardians or to the helpers of these people, in order for them to take care of themselves or take care of their beloved ones who are already suffering with this?
See, there should be some awareness, like as you are conducting these videos and all to give awareness to the people, they should be able to differentiate first of all, and they should be able to speak up. They should be able to tell their near and dear, like, I'm having this kind of pain. Is it normal or not? They should always come to a doctor. Just don't sit at home. And they should not feel alone. Most of them, because of the chronic pain, they'll feel withdrawn or easily agitated, mood swings, irritability. All this they can't explain. But
Right.
because of this, some awareness campaigns or videos as you're doing, they should come out and speak, and they should
Right.
prioritize their self care also. That's what I
Right.
can say.
I appreciate it, ma'am. Really, I mean, that's one of the reasons why we are doing these videos to reach out to as many public as possible, so that it at least triggers them to go and reach any healthcare professional nearby and get their problems resolved. Ma'am, at the
Yeah.
beginning of this recording, you spoke about endometriotic line can grow outside the uterus or outside the pelvis. It can also go into bowel and all. Is there a chance or is there a scenario where this endometriotic line can go to lungs? You already said yes for lungs, but also to the brain on the top?
Yes, it's very rare, but it can go to the brain also. It is called intracranial endometriosis, where the endometriosis lining goes to the dura mater of the brain. There are three layers in the brain, so it goes to the dura mater, in which the patient presents with headache, seizures, and even altered consciousness, mainly during menses. So with that, we can identify that is there is something abnormality, like they present during menses. So it is called
Okay.
intracranial endometriosis.
Okay. So this travels through the blood, ma'am, or does it travel through anything else? I assume
Yeah,
it is
there
only through
are
the blood.
there are different theories for this. There will be sometimes there will be direct implantation, sometimes as I told the retrograde flow of the menstrual blood. So there are different theories, but till now there is no conclusion like what is the connection. But there are two to three theories supporting this growth of the endometrium.
Okay. Okay. Yeah. Ma'am, we were talking about endometriosis, and while we were researching, we also heard about this term adenomyosis. Madam, what is this adenomyosis? Where does it affect?
See, like in adenomyosis, we see the growth of the endometrial lining in the uterine muscle. So because
Okay.
of that, there will be increase in the size of the uterus. So this is
Mm.
adenomyosis.
Ma'am, I also have read that this usually happens for women who are who have surpassed the menopause stage. Is that true? This
No,
adenomyosis?
no. No, no, no. It is an estrogen dependent condition. Usually,
Okay.
after menopause, there will be decrease in the symptoms of adenomyosis
Okay.
because the
Right.
ovaries will decrease the amount of estrogen production in menopause. So, definitely, there will be decrease in the adenomyosis in
Okay.
menopause.
Okay. All right. All right. Ma'am, you mentioned that adenomyosis is a tissue that forms within the uterus, right? So will this adenomyosis affect the vaginal birth?
See, there are like in stages of endometriosis. In adenomyosis also, there is some grading which called focal adenomyosis or diffuse adenomyosis. In diffuse adenomyosis, what happens is the endometrial lining is diffusely grows in the uterine muscle. So because of that, the elasticity of the uterus will decrease and the ability to contract during labor, during delivery also decreases. Because of that,
Okay.
there will be prolonged labor and failure to progress in the labor and definitely land up into cesarean section. But
Okay.
there is focal adenomyosis, like very minimal adenomyosis tissue. They can definitely go through normal vaginal delivery.
Okay. What are the treatment options for adenomyosis, ma'am?
Usually, depending upon the age, if the age of the woman is above 45 and if the family is completed, we definitely go on to the hysterectomy because there is no other
Okay.
medication to decrease the at that age. In reproductive age, we can definitely go for conservative management.
Okay. Okay. Great. Ma'am, when we were talking about endometriosis, you were talking about endometriotic cysts. And in relevance to this, there is another concept called uterine fibroids. Are they different to this endometriosis, ma'am, or are they the same?
So they are completely different. Fibroid is nothing but a muscle. It grows in the uterine muscle. Like there are different kinds of fibroids, like intramural, subserosal, intracavitary fibroid. There are different types of fibroids that grow. Like they grow within the cavity or within the muscle or outside the uterine cavity. These are completely different from endometriosis and adenomyosis.
Okay, but do you place these uterine fibroids into cancerous related cysts, ma'am, or they're not cancerous? They're not related to
No, they are
cancer.
the very, very rare chance they develop into cancer. Very 1 to 2% chance they develop into cancers, but usually they won't develop into malignancy.
Okay, okay. What are the symptoms to observe to say that this woman may have these uterine fibroids?
Yeah, usually the same symptoms in gynae, heavy
Okay,
menstrual bleeding, pain during menses, because the as the uterus is growing, the endometrial lining also grows. So because of
okay,
that, more surface area, more bleeding. So heavy menstrual
okay,
bleeding is already as a symptom of fibroids, and apart from that, pain during fibroids, pain during menses, also as a
okay,
symptom.
okay. And the treatment options also remain the same, ma'am. What are the treatment options for uterine fibroids?
For uterine fibroid, surgery is always effective. Even this also depends upon the age, obviously. When the woman is planning for pregnancy and she has a fibroid, we will go for only myomectomy, that only removal of the fibroid. If she has completed family and still she is having fibroids, they will go for hysterectomy. So, depending
Okay.
upon the age and fertility preservation, there will be treatment, but surgery is always effective treatment.
Always effective. Okay, thank you, ma'am. Ma'am, what we have done is when we were, discussing about this topic, we reached out to a lot of general public and have them ask any questions they personally have or in common. So they sent us a series of questions, ma'am, which I'm going to ask you one after the other. These are all collected and compiled questions from general public. These are all related to endometriosis and not just endometriosis, but also other related health conditions for women, ma'am. So we shall start and we'll go one after the other.
Sure.
Ma'am, the first question is, how does the current lifestyle of women affect the fertility of their future children?
See, always the balanced diet will affect the reproductive health because the hormonal imbalance which occurs due to processed food or fatty food and the nutritional deficiencies will also land up in decrease in the egg quality. So whatever you eat, how you manage your stress, how you manage your weight will definitely impact your future fertility.
Okay. Then the next question, there is a myth or probably there is a rumor that says women who live together will also have the menstrual cycle together at the same time. Is that true or false?
It is definitely false. Previously, in 1970s, it is also called as McClintock effect because McClintock has done some research and told that there is synchronization of periods between friends. But later on, that they have done many researches and they told that it is not true. It's just a myth.
Okay. Ma'am, the next question, what is the optimal age for a woman to give birth to a baby?
See, there is no strict cutoff for age to give birth to a baby, but as the age increases, we know that egg quality and quantity decreases. That between 35 to 37, there will be beginning of decline, and after 30, there will be sharp decline in the egg quality. So, better to get pregnant before 35. But there is
Okay.
no strict cutoff for age.
Okay. Ma'am, there is this next question which may not be appropriate for certain audience. However, the question is, certain women experience pain during intercourse. Is that normal? Or if it is not normal, how do they identify it and see a doctor?
See, to some extent, it is normal, like when there is any vaginal dryness, infections, like pelvic inflammatory disease, vaginismus. These all are curable. We diagnose that there is very vaginal dryness, we will give some medication to control the dryness, like that. In all these conditions, it is normal. And some psychological stress and anxiety may also cause pain. But if the pain is persistent, recurrent, and there is some bleeding after intercourse, and some abnormal discharge after intercourse, then it is abnormal. Then you should definitely go and see a doctor.
Ma'am, the next question is also something very common. Will regular intake of these birth control pills affect the fertility in the later years?
No, they just temporarily pause the ovulation, but doesn't damage the egg or reproductive health. So taking long-term birth control pills doesn't affect your fertility.
Ma'am, what is that one thing you recommend every woman who is in her 20s to start doing so that it helps their reproductive health in the later ages?
See, they should learn how to track their menstrual cycles first of all. If there are any irregular menstrual cycles, they may be caused like PCOD and thyroid issues, and definitely they can get a help from the doctor in future fertility. They can easily early detection of the menstrual irregularities. That is what they have to do in the early 20s. I feel.
Okay. Ma'am, the next question is most of the women complain of irregular periods. Are these common? If they are uncommon, what are the list of issues that they may have to be looking for when it comes to these irregular periods as one of the symptoms?
See, irregular periods are not always a problem because in teenage, like up to 21 years, there will be irregular periods because there will be no proper maturation of the HPO axis, what we say, the cause for menstruation. And then perimenopause, we can say like 2 to 3 years before menopause, also there will be irregular periods. So apart from this, they are still having irregular periods like 24 to 38 days cycle is always normal, like within 24 to 38 days if the woman gets a period, it is always normal. Apart from this, they're still having irregular cycles, there may be PCOD, thyroid issues, or any anemia. All these conditions they have to rule out.
Ma'am, there is this other question which is asked, which again most of us can relate to, that every pregnant woman will have a glow on their face. What is the science behind it, or is it just the thought in our minds is making us believe in that?
Yeah, it is a real phenomenon for some, but not it's a universal phenomenon because
Okay.
there will be increase in the blood flow in pregnancy. Because of that, there may be some glow, and also increase in estrogen progesterone cause the oil production. Because of that, the face looks shine. So these are
Okay.
some uh, reasons behind it. But everyone doesn't have a pregnancy glow. Some will have
Okay.
glow also.
Okay. 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 Got it, ma'am. Yeah. Ma'am, the next question is again an important one. What are the vaccines that every woman should take before they turn 30?
Yeah, that's very great question. So definitely HPV vaccine they should take. Ideally from 9 to 26 years it is recommended. And now FDA has approved till 45 years of age also. And apart from HPV vaccine, they should take influenza vaccine, MMR and varicella if they are not if they have not taken in the childhood, and hepatitis B and hepatitis A also. For travelers, mainly hepatitis A vaccine is important. And recently, we should add COVID-19 also to our list.
To our list. Yes, yes. Okay. And the next question is, people say that HPV vaccine is only supposed to be taken for those who are sexually inactive before you become sexually active. Is it safe to take HPV vaccination if you are already sexually active?
Yes, it's definitely is, because you're not exposed to all types of HPV variants. There are different
Okay.
strains in HPV. So you should definitely take HPV vaccine even if you're sexually active. And it doesn't treat existing infection, but it will prevent future infections. So you should
Okay.
definitely take HPV vaccine.
Ma'am, the next question is, just like our body rejects an organ when it's transplanted, can woman body can also reject pregnancy? Can that happen?
Yeah. Yeah, that's a fascinating question, and the answer is yes, because the fetus is obviously half from the father, so that is definitely a foreign DNA. But magically, what happens is in pregnancy itself is the immune suppression state. So
Mhm.
it suppresses the immune system of her own body to accept the fetus. So in some
Okay.
cases where there is some problem with the immune system dysfunction, then it will result in miscarriages and other complications in pregnancy.
Ma'am, generally, doctors say that the fall of pregnancy happens after 35 years of age. Why do they say that?
See, women are born with around 1 to 2 million of eggs, but by the age of 35, there will be a reduction or decrease in amount. There will be only 25 to 30,000 of eggs. So, as the
Okay.
age increases, the egg quantity decreases and also the quality. That's why doctors suggest to get pregnancy before 35 years of age.
Ma'am, the next question is, in the same way like women, does men's sperm quality also reduce after a certain age? And why no one talks about it?
Yeah, definitely there will be a decrease in the sperm count. Like in women, there will be a decrease in sperm count and quality, and also the morphology. And as the age increases, the DNA fragmentation also increases in sperm. That will result in chromosomal abnormalities to the offspring or to the fetus.
Oh,
So
okay.
definitely you should consider the father's age also. And nowadays there is increasing awareness of fathers related issue also in infertility.
Right, right, ma'am. I heard about it too. Yeah. Ma'am, the next question is related to technology blended medicine. There are a lot of period tracking apps. Are they really useful for conceiving?
See, period tracking apps can just estimate the ovulation, and they can tell you your fertile window, like 5 to 6 days. So it can definitely increase the rate of fertility, but not always. And not, I suggest not going to basic apps, but the apps which include the basal body temperature tracking, LH input, and cervical mucus consistency. Uh, the apps which have these information, better to use those apps, no, other than
Okay,
basic ovulation
okay,
tracking app.
okay. That's a valuable information, ma'am. Ma'am, there is a lot of quack science out there. So can you clear this doubt whether we can know whether we are pregnant or not before we miss the first period?
Yeah, definitely we can know, because there is a hormone called beta HCG which is detected in the blood even before the urine test. So before missing period, like 6 days before missed period also, you can detect beta hcg in the blood, and you can know whether you're pregnant or not. But I don't suggest yes, we can wait for a missed period, because some will have different cycles, like some will have 21 days cycle, some will have 35 days cycle. 21 days cycle women can obviously know her pregnancy state even before missing period, but 35 days cycle women can't know, so she has to wait
Okay,
for a missed period. So I
okay,
suggest, just don't get stressed. Let the period be missed. Then you can find it out.
okay. Okay, let's not be too over enthusiastic. Okay, great.
Yeah.
Thank you, ma'am. Ma'am, I think it's a wonderful educational podcast we have done today. Just to summarize for the sake of our audience, ladies and gentlemen, any one of you having any of these symptoms which we have discussed in today's meeting, please feel free to reach out to Dr. Monica. She is there on our app, Medicas. You can download Medicas mobile application from Play Store or App Store. We also have a website, www.medicasapp.com. You can find her there and you can consult her directly one-on-one online and also take her opinion in terms of the symptoms that you're facing. So just to recap, we have what we have discussed in today's session. We have discussed about endometriosis, its symptoms, treatment options, adenomyosis, uterine fibroids, and some basic questions which are running like rumors and viral in the social media, which Dr. Monica Y has busted and clarified it to us. Thank you so much, Doctor, one more time. We really appreciate the time you are investing in ensuring that every woman understands about their body and the myths that are going around. So, this contribution you're doing to the society, we really have to take our hats off to you, ma'am. Thank you so much
Thank
once
you.
again.
Thank you so much. Thank you.